Started your timer, and here is your question. Not too much to read.
Okay, ma'am, I'm ready.
Yes, 30 seconds left.
Okay.
Even once you're done during the exam, wait till the bell goes,
Okay.
Yes. Right. So if you have read and understood, considering the clinical examination station, kindly please begin.
Yes, I will enter the room. I will wash my hands. I will introduce myself. Hello, I'm Dr. Faizan. I'm one of the surgical doctors. May I confirm your name and age, please?
Yes, I'm Smith, 55 years old.
Nice to meet you, Mr. Smith. Today, I've been asked to examine the swellings on your back. This will involve me looking and feeling your swellings and listening to your swelling. Is that okay with you, Mr. Smith?
Yes, yes.
Okay. Uh, I will ask the patient to remove the t-shirt or shirt and expose the back. Do you have any pain before we proceed, Mr. Smith?
No.
Okay, that's great. I will make the patient sit, and I will examine the back of the patient. I'll inspect the back of the patient. I will look at the number of swellings, the site of the swellings, the shape of the swelling, the surface of the swelling, the skin over the swelling, and any scars over the swelling. Then I will tell the patient that now that I'm going to feel the swellings. Then I will first look for the local rise of temperature with the back of my hand. Uh, Feel for the temperature with the back of my hand. Then I'll check for tenderness over the swelling. Then I will check for the surface of the swelling. I'll feel with the fingers of my hand, the palmar side. Then I will feel the edge of the swelling with the pulp of my fingers. Then I'll feel the consistency of the swelling, whether soft, firm, or hard. Then I will feel if the swelling is cystic, I will do the fluctuation test. Then I will also do the compressibility test, and I'll see whether it is compressibility test. I will check the fixity to the skin by pinching the skin, and I will check for the fixity to the underlying structures by I will ask the patient. I will I'll, if it is on the back, depending on the site where it is, I will make the patient move that muscle, contract the muscle, and I will check for the mobility of the swelling. Then I will check for any pulsations of the swelling by using two fingers. Then I will go for percussion of the swelling. Then I will auscultate over the swelling with the stethoscope. And then also I will check for any inguinal or lymph nodes in the inguinal or axillary region,
Or even
or
cervical, depending upon if it's
cervical,
on the back
cervical
of the
also.
neck. Yes. Yes. And
And then that's all. I will thank the patient. I will wash my hands. Uh,
and you'll ask
th-
the patient if patient needs help in dressing up. Two more things. One, you'll measure the lump if possible, if it's big enough, and it can be measured with the measuring tape provided. If not provided, ask for it. Uh, if they'll
okay.
say consider, that means you have to imagine yourselves and consider measuring it
Okay.
yourselves, like in your mind. And then if torch is available, then you have to transilluminate the lump
Yeah.
as well, if
I forgot.
possible.
Okay.
Yes, these are the 2-3 things that you've missed. Did you look for the edges of the
Yes, ma'am, I
lump?
mentioned.
Okay. If you are done with the examination, can you please summarize your examination?
Yes, I've examined a 55-year-old male patient who presented with multiple swellings on his back. On examination, there were multiple swellings over the back of the patient. The Ma'am, the details.
Yes,
How
you
to
have to
should
tell
I
me the details.
I have
Just
to?
imagine and tell me if it's the lipoma that you're examining. So how is it in consistency?
Yes, lipoma. It is
It's soft, yes, and
soft in consistency. Multiple
and
swelling, soft in consistency, and the edges are well defined, and
yes,
the slip sign will be positive.
overlying skin is free, yes, and
Yes, there is no fixity to the overlying skin or
underlying
underlying
skin,
muscle,
yes, yes.
and
Shape is oval
and
or round, yes, oval in shape. And what would be the measurement?
uh,
If you look at the lipoma in normal life, how big would that be?
maybe 6 into 5 into. We
Centimeter,
have to give
yes. You have to give
three-dimensional.
measurement in centimeters, like 5 into 10
Yes.
centimeter in size,
Okay. 5 into 10 centimeters in
because you
size. The
always
overlying
take
skin.
vertical and the horizontal length.
Yes. Okay.
Yes,
And the overlying skin is normal.
yes.
Uh, there is
Lump
no
is
fluctuation.
not pulsatile, it's not compressible, it's not reducible, and it's not tender.
Yes, non-tender, non-pulsatile, non-compressible. Fluctuation is negative.
Yes.
Uh,
And
then there is no bruit which can
yes,
be heard. Um,
no lymph,
there,
no associated lymphadenopathy if there is not. Okay.
yes, no associated lymph.
And transillumination test was negative.
Translumination.
So
Yes,
considering this, what are your provisional and differential diagnosis, please?
considering this, my provisional diagnosis is like multiple lipomas. Uh, my differential diagnosis would be maybe a sebaceous cyst, uh, a fibroma, or hematoma, or
Or
uh,
even at the end, maybe abscess. Okay, what investigations would you do to confirm your diagnosis?
yes. I will do blood tests, including full blood count, ESR, CRP. I will do ultrasound scanning of the swelling, and if needed, CT or MRI scanning of the swelling. Then for a histological,
Yes,
maybe FNAC or
yes, yes,
excision
yes.
biopsy.
Maybe FNAC, not maybe, definitely FNAC, because your second or third was fibroadenoma. So you have to rule out histologically. And what management can you offer to the patient?
Yes, the management will be excision of the lipoma.
Excision, very
Uh,
good. How would you differentiate lipoma from sebaceous cyst
yes,
on
the
examination?
sebaceous cyst has a putty-like
Punctum.
consistency and
Yes,
a central punctum.
yes. All right. Good. Okay, good. Right. All right, one last question. How would examination differ if you had the same lump or the swelling on patient's thigh instead of on the back or the back of the neck? How would the examination differ?
The thigh,
First of all, exposure will differ. Yes.
yes,
Secondly,
yes.
secondly, once you're examining the thigh,
Uh,
so would you or would you not consider examining the joints? Could that be something which can
yes,
influence or affect a patient's movement?
yes. Hip and knee joint.
Yes, will
should
be
be
examined. Yes, because it could be anything. It could even be a bone tumor or soft tissue tumor or whatever. So you have to consider the joint movements as well, joint above and below. What else? Vascular,
the
yes.
pulses,
Pulsations, yes.
the femoral
Pulse and popliteal pulse as well, yes. Distal pulse as well, you can maybe rule out.
yes,
Anything else? Neurological examination, maybe sensory and motor loss. If there is any, you have to rule it out.
okay.
Yes.